I still
How you
have
doing?
stuff in your one.
This is out of town. Okay, we are good to go.
Okay, yeah, so I'm going to call meeting to order at 5:40, it looks like. And we can go through introductions, even though I think most of us know each other. I'm Jan Lynch. I'm serving as chair today because Elise couldn't be here.
Ellen McConnell today.
Randy Brown, County Legislator.
Corinne Palazzo, Administrative Assistant.
Frank Rupa, Commissioner.
Mary Hutchins, member of the board. Sheila McHenry, member of the board.
Stu Bergman, member of the board.
Thank you. Are there any additions or deletions to the agenda?
Just a question, are we, Libby going to be?
We are unable to get
Oh, there's,
of her, so I don't know.
Okay,
If she,
Well, she's Liddy.
yeah,
She'll be checking in at about 10 minutes to 6.
oh, okay,
oh, that's good to know.
yeah, so it's
Weren't sure.
got 10 minutes. Good, okay, so that's good news.
So wait, we still don't have enough to do, right?
Yeah, 1, 2, 3, 4, 5, 6, now,
Okay, so there's still not enough to approve the minutes from April and May, so they'll carry over to our next meeting. And then privilege of the floor. Does anyone have any questions or comments or any events or anything like that? I heard the developmental disabilities fair this morning had a lot of vendors, but not as many participants as they would have liked, but it was still a good fair in terms of everybody getting together and getting used to each other's services that they can provide. This was up at the Y this morning, and the chairs of the DD subcommittee worked hard to put that together.
they did, yeah. And maybe DTC subcommittee will be meeting next Tuesday, and maybe we can kind of talk a little bit to do some follow-up as to, ways for the future,
Yeah.
get more participants, maybe it was when it's the day, maybe it was the location, any number of things, but just to,
Yeah. And it's the way a lot of things are going, though. Job fairs and such just don't get the kind of turnout they used to. I know this wasn't the job fair, but it's really a lot to think about how to attract people. So next is the board correspondence or announcements. I just wanted to remind people to fill out the survey if you haven't already that went out or about the substance use and such, right? That's what it was about.
The opioid one has closed.
Okay, so what's the one that's,
There was a local services plan.
okay,
That's still open?
The needs assessment survey.
Yes,
So
is that still open?
it's still open.
Okay.
okay. I thought I saw something on Friday. I just got mixed up which one. One of the questions was about changing the date of the July meeting. I'm sorry, I moved on to chair's report, which is everybody ready for that? The only thing I had, which I don't even know if it is best under this one, it's more like new business. But the July meeting is on July 3rd, Monday, July 3rd. So the 4th is the next day. So the assumption is a lot of people might be trying to take a extra long weekend. Plus Elise is out of town again. So and then she was out of town a lot of other Mondays in July. So we came up with the suggestion that perhaps meeting in August, when we usually don't have a meeting, instead might make sense, but I don't know what people think about that. It would be, the most likely date would be Monday, the 3rd of August, I believe. No,
If you're looking at
The 17th.
Yeah,
yeah, it couldn't be the 17th, could it?
no, 7.
7th, okay.
So the one problem we have is that the local services plan is technically due at the end of this month. Our plan was to bring it to the for the beginning of July at your meeting. There's a couple of options. You could reschedule in July. We could attempt to do a essentially approval by acclamation, which would be an email that goes out to everyone. And as long as everyone votes affirmatively, then we could do it that way. If there are questions or someone doesn't want to vote in the affirmative, we would then be in the position of trying to schedule a special meeting in July to try to get that in as soon as possible.
That seems a little tricky, doesn't it?
Yeah, particularly because we have some non-active members of the board too. So because we would need everyone to vote in the affirmative in order to do it that way. It's not just a majority.
But if we had an in-person meeting, Frank, could you clarify, and the inactive members continue not to be present even in person, could we still?
Yes, as long as you have an in-person meeting with quorum, then it's majority of people.
But we would need a quorum.
Need a quorum. We need a quorum to do anything,
Right.
right? But to do it outside of a meeting, it has to be
Has to be everybody on the list, right? As a member.
So what's wrong with the 10th of July?
I think it was just that Elise said she couldn't do that either, and that's how we moved on to, and I think another date she said she couldn't do on a Monday, so maybe we should go ahead and schedule, and in that case, I mean,
Deadline, right? I'm hearing.
Yeah, I mean, we're already gonna be missing the deadline, so we're gonna have to ask for a bit of an extension because it's due at the end of June. So I mean, we could ask for an extension to August, but that wouldn't be our preference as a department.
yeah. And there's also the possibility of Monday, the 26th, which is only 3 weeks away, though. I mean, the 26th of June. Like if you wanted to get it done.
No, I don't know that we'd be necessarily ready by Monday, the 26th of June.
I think that would be pushing it because Elise was going to, Corinne, did Elise get some meetings sometimes scheduled with all the chairs to come together?
No,
Okay, because we need to do that. So and we're gonna try and do that the next couple of weeks. So probably the 26th is gonna be tough.
Okay, I just thought I'd throw it out there.
Yeah, it'd be good if we could get it done that fast.
Does it have to be a Monday in July? Can it be a different day?
That's what I was thinking, maybe.
Which Monday?
it's Tuesday.
I couldn't hear
He
him.
was suggesting it be another day of the week instead of Monday.
I can't.
It doesn't
Tuesday or
matter to me. I mean,
group on Tuesday night.
Well, if
The
you,
10th of July, Alicia's the only one that can't be here. I mean,
I can't remember now.
I'm not sure. I think she said like 2 weeks, so.
It seemed like she had a lot of times she wasn't available, so we may just have to go ahead without her, but prod her a reminder to hold that meeting, arrange that meeting ahead of that time if she's able to. The meeting with all three sub.
yeah, I mean, if everyone here came and we had Travis and Jessica, you'd have a quorum.
Okay,
So, I mean, we can check with them.
Yeah, Travis will be coming late. He had another meeting, so he'll be here like 6:30
Okay,
today, but Jessica, I don't know about, she did say she wouldn't be able to attend today.
yeah, so we can double check. I mean, if this group is okay to do July 10th, we can check with Jessica and Travis and see if we can
okay.
get a quorum.
Okay.
Is the 10th okay, Harmony?
Yeah, that will work for me.
Then that avoids the July 4th holiday week completely.
Travis and Jessica.
I mean, Jessica's usually really good about attendance, so.
Yeah,
He's
And
just on vacation right now.
as is Travis, but he's just got that thing going on, the conflict during the
Yeah.
summer with
Yeah.
TC3. So we can see.
Can everyone here
is,
commit to the 10th?
I could.
Yeah.
Okay. So, yeah, Yeah, all right.
Okay.
Are you going to contact them or would you like me to?
I'll reach out to them.
Okay, great, thank you.
That would work best for us. We can make that work.
Yeah, it seems
Same
like,
time as usual. and-
Yeah, same time and place, yeah, 5:30.
okay, so that was the only thing I had under the chair's report. And next is subcommittee updates, but don't know. I'm an update, Sheila, for the
We
DD
meet
stuff.
next week. So, yeah, so I don't have an update.
So maybe at the 10th, the meeting.
Yeah, I'll make sure, yeah.
Okay.
And I guess, I know Elise had been talking about getting the updates from the chairs and maybe we can ask where she's at with that. She was hoping, one of the things that she was hoping to do for the future was to get those updates ahead of time and then,
Yeah, that's what the
Yeah,
minutes
but I will
say,
get-
are they're supposed to be prepared.
but I'll get
Give a
update.
report,
Yeah, I can give an update.
and I know you're not the chair.
Yeah, but
so-
still I'm there. So the July meeting for the July,
Okay,
I'll get an update, yeah.
and I don't think there's anyone here. Are you, Sally, are you on the developmental discipline? I mean, that's what
Have
we're just talking
applied
about.
to be a member. so-
Might keep waiting for the legislature.
Well, we have to get the recommendation from us, from the CSB to move to the legislature for their approval.
Okay.
Did that last.
We weren't able to go to executive session because we didn't meet a quorum and Elise was supposed to reach out to the other members, but we didn't get a chance to do that, remember?
But presumably I would.
Frankie recommended that.
She was supposed to reach
She
out to
was gonna reach out to the other members that weren't here to see if there was any opposition.
I see.
So that may be what had slowed it down.
If there is anyone.
Opposition, because we didn't have a quorum. So we were trying to kind of find a way around that with the recommendation. I think at this point, we can probably put those forward with, saying that
You said the nominating committee endorsed.
yeah, and that the members present were all in support of it. So let's just go ahead and do that
Okay.
and let the legislature.
should we do that in executive session again, or,
No, I think we've already
Okay.
gone through that, but let's put those
okay,
names.
so we had 3 candidates.
Meeting. Yeah, I'm sorry, I lost track. I was for 2 weeks unexpectedly and then Harmony's been out, so we're a little discombobulated at the moment.
Yeah,
We'll get back on track.
easy to get discombobulated.
Yeah.
At least I find that. Mary, do you have any update for the mental health subcommittee?
No, I wasn't able to make the last meeting, so.
Okay. And.
We didn't
Do,
have a meeting.
that's right, there wasn't a meeting for substance use. So I guess that's a really short notice, or short session too, talking about the subcommittee updates, but hopefully in July, maybe we'll have a few. And then we're almost to the point where
Lydia's joined us.
Lydia will be coming
She's
on.
already joined, but yes.
Want me to check and see if she's ready?
Yes.
Oh, she is.
Hey, Lydia.
Hi, how's everyone tonight?
Good, how are you?
Good.
Good.
So we have Liddy Barger here, who is the Director of Housing Initiatives for the Human Service Coalition of Tompkins County, and she was going to give us an overview of the proposal for assisting homeless people in Tompkins County.
Great. Thank you for the introduction. That is true. My name is Liddy Barger. I use she, her pronouns. I'm the Director of Housing Initiatives at Human Services Coalition. I'm here to talk a little bit about Home Together Tompkins. What I have for you tonight is kind of like a broad overview of what is a pretty dense document, and I'll give you links for it if you need access to the full document, but I wanted to just make sure I hit sort of the broad strokes tonight, and I'm available to answer questions and stuff like that when we're done. So I'm going to share my screen. I'm going to turn off my camera while I have my screen sharing because I only have one screen and I get very distracted by having my camera on with a screen share. So I will turn my camera back on after my screen share is done. Thank you.
Thank you.
Yeah. All right, we'll get started. Everyone can see my screen and it is full screen and everything, right?
Yes.
All right. Great. All right, so I am here to talk today about Home Together Tompkins, which is the Continuum of Care's homeless response system plan for ending sort of specifically unsheltered homelessness, along with enhancing the service delivery for people who experience severe service needs here in Tompkins County. So this is some background about how we kind of got to the plan as it is. This didn't sort of come out of nowhere and is actually the end result of many, many years of many, many people working together around the issue of homelessness. Locally, the Continuum of Care has been around for a long time. We've been having these conversations. In 2021, the city of Ithaca, Tompkins County, and the Continuum of Care came together to commission a really in-depth homeless needs assessment for our community. Probably kind of the most comprehensive look at our own local data and comparing us to other systems that had been done at least in about 10 years. So that happened in 2021. The results came out. The Continuum of Care spent a full year of work groups taking a look at the findings of that report and the recommendations of the governance committee of the Continuum of Care. And those really fed into some of the, especially the more local flavored recommendations that are part of this plan came out of that kind of work. We also took great care to align it with the federal strategic plan to end homelessness, which used to be called Home Together. They've actually recently renamed their plan. Their plan is now called All In, but we're sticking with Home Together here locally for now, at least. They are a federal working group that has membership sort of across all of the federal departments, HUD, Health and Human Services, all the sort of places that you would expect to see representation working at a national level around issues of homelessness. And then we wanted to really make sure that we were taking care to frame the issue using a public health lens and think a little bit more upstream and broadly around the issue of homelessness, the drivers of homelessness, and some of the solutions we could bring to bear. So that's some of the background. This is the mission of a Continuum of Care. So Continuum of Care, just in case, because people, it's sort of like a hazy concept, I think, sometimes, designed to be a cross-sector planning network. We have about 30 official members across the spectrum of providers here locally. And this is our mission. Our mission is to make homelessness rare, brief, and one time here in Tompkins County. Used to be to prevent and end homelessness, but we have switched to making it rare, brief, and one time. To do that, we organize the community-wide effort. We convene community conversations. Some people have probably either been to a Continuum of Care meeting or a Health and Homeless Task Force meeting. Those are Continuum of Care initiatives. We're also a funder, so we are the lead agency for a mechanism that brings in HUD dollars that are used to support our permanent supportive housing projects here in Tompkins County. And then we're tasked with promoting access to services and housing using our coordinated entry system primarily, along with some other strategies. So that's what a Continuum of Care is, just as for your knowledge. Throughout this plan, so this plan is very specifically focused on people who are either in this category of severe service needs or experiencing unsheltered homelessness, which is included in the definition, but we did want to call it out specifically. So HUD actually just about a year ago came out with a new funding opportunity and introduced this concept of persons with severe service needs as a standalone category for funding in their system. The definition is there. I think we could probably all picture a person that we could imagine might have severe service needs. They're people who have been called heavy utilizers in the past. They have a higher vulnerability to illness or death, a vulnerability to victimization, and some of those other things. So you're going to see that phrase throughout this plan. So we wanted to make sure we gave a good, clear definition to it. And then housing first is another term that is used throughout this plan. Housing First is a concept, it's data-backed and evidence-based set of interventions and approaches to homelessness that basically asserts that that all persons are housing ready, and that in order to properly sort of stabilize the whole individual, you should serve them with housing first and then wrap the services around them second. So it is sort of the opposite of what used to be called the treatment-based model or the merit-based model of housing, which set up a system for folks where they had to have X numbers of days without using substances or engage in specific prescriptive treatment. You must see your mental health counselor X number of times before you can come into housing. This says, come into the housing first, and then we'll get your services centered around you second. So what is Home Together Tompkins? It's a community-wide plan. What we're hoping for is to sort of use a change model to get people community-wide geared up towards the goal of ending or preventing unsheltered homelessness and better serving people with severe service needs. There's opportunities for people to plug in all different ways throughout the plan, and it's definitely for everyone, right? So there's no expectation that this continuum of care, which is staffed by 2 humans, will be doing everything. There's every recommendation in this plan, but we're looking for partners and people to take pieces of it and bring it to life, right? The strategies included in this plan, which we're going to get into a little more, is to increase our stock of permanent supportive housing, which we can talk about a little bit in more detail later, to expand our emergency shelter capacity, both in its size and the type of emergency shelter that we're able to offer to individuals experiencing homelessness. There's a plan in here about a housing surge that we'll also get into. And there's also some ideas about how to address some staff shortages, address some of the capacity issues that we're seeing in the not-for-profit and probably other sectors right now, and sort of generally improve access to resources for people in that severe service needs or unsheltered house category, and really everyone. This is what we hope to achieve. We want to reduce the number of people experiencing unsheltered homelessness and also try to reduce the number of people experiencing chronic homelessness in our system. So here in Tompkins County, we have a higher than average percentage of our population of people experiencing homelessness that meet the definition of chronic homelessness. And in order to meet that definition, it means that they have a disability and a long period of time of homelessness, either 1 year without a break, or what adds up to a year of time experiencing homelessness with some breaks. So we want to get that number of people with experiencing chronic homelessness reduced as part of this plan. We want to improve health outcomes. So one thing that the data around Housing First really supports is that when people are have these rapid exits into supportive housing, even if they aren't sort of immediately becoming sober and changing their entire life, they are reducing their emergency room visits. They're having less contact with law enforcement and courts, and just sort of generally having a more stable and healthier life. We also really do want to find a way for this community plan to create a pathway for better relationships across the community with neighbors, business owners. Sort of, it takes a village, right? And we know that tension is high right now, and that unsheltered homelessness has increased in its visibility, certainly, and people are talking about it in public discourse significantly more than they have even, I'd say, 2 years ago. And we just want to make sure that everybody feels like they have a seat at the table in those conversations. So we don't have to get too much into this slide. It's a big slide. These are some barriers to shelter and housing that were collected through various parts of data and research, or focus groups or qualitative interviews within the past, or I'm going to say 5 years within our continuum of care. These are the most commonly cited barriers by people who are attempting to navigate those systems. sort of the number one that we hear probably the most has to do with the cost of paying for an emergency shelter stay if people have income, earned or unearned income during the non-cold weather months. That's a barrier that people cite regularly. And then some of the other ones are things that you hear a lot. Is, you know, the paper is hard to navigate. The paperwork is hard. There's a lot of oversight and compliance. And then we also hear a lot about habitability in our system right now. So the units that are available in this sort of lowest cost housing often aren't or don't feel habitable to people. And they are saying, I would rather be sort of outside than in these units. People can look at that slide another time if they're interested. This is a crazy slide. It's the meat of the plan. I won't do every single piece of this, but basically the whole plan falls into what we would call 3 categories or buckets of types of interventions. On this slide, they're categorized into short, medium, and long-term interventions, and also in their sort of categories. So the ones that I get sort of most jazzed about are probably the access to housing components of the plan. So all the data and research that we've taken a look at about our local system indicates to us that we are at basically at least 100 units of those studio and 1-bedroom size permanent supportive housing units short. So we need a minimum of those 100 units of permanent supportive housing to have a supply suitable to meet the demand of people with severe service needs or living in an unsheltered location. Another access piece would be to take a look at our existing shelter system and find out if there are some ways that we can integrate some of the low barrier shelter concepts into our existing system in such a way that people are better able to access our emergency shelter. And then we have a whole crazy plan about a housing surge that we will explain. Housing surges are a strategy that come actually from disaster relief models after hurricanes and things like that, where basically, I have a slide about it later, but that's where that is inspired from. The incentive programs have a little bit to do with that community neighborhood rebuilding stuff. This is where we want those business owners, landlords, people that are feeling some of the negative effects of that growth in our homeless population. This is where we're hoping to plug in with those folks and to find out, okay, we may not be able to make you completely whole financially, but how can we ease some of these tensions? Would it be helpful to have a mitigation fund for some losses, for some damages, things like that? There's incentives in here that have to do with trash. That's a super like hyper local idea that came from this group of people that were meeting around what to do about the shopping cart situation in the West End, and some other things. These are mostly about access things. And then we do need to expand our sector capacity. There are some gaps. There are some ways that we could specialize in areas, I think, in our system to better serve these folks and accessing permanent housing. And so we do have a proposal which was actually partially funded already through the Tompkins Community Recovery Fund to add these specialized enhanced housing navigation roles to the system. Right now in our system, there's actually no person who has more than maybe 10% of their position committed to helping people with actual housing search, like helping people look for housing or contact landlords and do all of that stuff. It's like a tiny wedge of a lot of people's job, but it's not the role of anyone. So that's one of the kinds of things this housing navigator could do. And also just sort of take some of that pressure off of other providers. So right now, one of the things that we hear most commonly in the continuum of care from a range of providers, so everything from clinicians who are trying to work in mental health care to people who are supposed to be doing SNAP benefits, anything. What they're actually doing all the time is housing with their clients. They're talking about housing. They're trying to make referrals into a system that they aren't fully expert in. It's frustrating. It's frustrating for the providers. It's frustrating for the people who are just trying to get the services. We want to take some of that pressure off of those folks so that they can do their jobs that they are there to do, and that person can get some housing specific attention from somebody. So the plan is whatever, there's a plan for those folks. We also do want to add some paid board positions for people with lived experience. Right now, that is certainly a voice that is missing from most, if not all, conversations about homelessness in Tompkins County. You know, we have some feedback mechanisms, but really it is leading practice to compensate people who have lived expertise for that expertise. And we want to stand up that board so that they can have a voice in these conversations. Also have some ideas about professional development opportunities to create a workforce of people with lived experiences of homelessness. Whew, that's a big slide. This slide actually comes straight from the United States Interagency Council on Homelessness. It's a way to think about low barrier shelter that I think a lot of times people hear the phrase low barrier shelter and they think, you know, that there used to be a term that people would say, which wet shelter, or some, you know, that it's going to be sort of this wild and uncontrolled environment, scary and violence and all of these things. But I have never seen a model in which there were no expectations. But what low barrier shelters try to do is think through basically, is this rule a rule because it's a rule, or is it an expectation designed around the safety and wellness of this community? So the focus changes from compliance to safety is really the way I hear it best explained. And they lean all the way into that trauma-informed operating culture in such a way that they, the ideal low barrier shelter really might be serving every single person in their shelter with a slightly different set of tools, right? Because they are using that trauma-informed culture as much as they can. Those relaxed sobriety and curfew measures, again, have to do with like, is this a rule because it's a rule, or is this a rule because it makes sense for the health and wellness of this individual or this community? And so these are just the things, the points at which emergency shelters who are considering shifting to a low barrier shelter model would be sort of thinking through what they're doing now and how it could change to this model. This is the housing surge. So it's exactly what it sounds and looks like. Basically, for our first housing surge, what we're going to attempt to do is create a by name list of all persons who have expressed an interest in entering housing and are currently unsheltered, so that we have a finite population that are the tenants of the housing surge. And then we are going to identify resources. Those resources could be things like permanent supportive housing units, vouchers to help pay for units, regular, private market units, and then all of the other additional supports that people might need. We kind of lower all the barriers in the background. So the people who are on the by name list, we've actually already started creating our by name list. We're working on things like making sure that they have photo ID. We're checking credit reports. We're doing criminal background checks. We're getting people paperwork ready to be able to quickly move in when units are ready. So that's sort of a snapshot of the housing surge process. We have a few surges we're going to try. We're also going to try doing a moving on surge, which is when you basically all of the people who have been in permanent supportive housing for multiple years and may be more ready to live independently, get surged into private market housing. And then those permanent supportive housing units are very quickly filled with people with high needs right now. That's the housing surge process. Who doesn't love a Gantt chart? This was our best plan when we made it. I think we probably are sort of a little ahead in some places and a little behind in others, but this was sort of at time of publishing our best plan for at what quarters we could start these projects. Some of the things, so Q2, you'll see a housing surge. That's the implementation of this housing surge I was just discussing. Q4's housing surge is going to be the Asteri move-in housing surge. So there's going to be 40 people who have that chronic homeless definition moving into units right downtown on Green Street in that project. So that's that one. That's what that chart is. We'll see. This is an aspirational chart. And then this is kind of a slide that shows like, what do each of these things need, right? They all need money. They all need somebody who's going to oversee them. What are some of the other things that they need? Do they need staff positions? Do they need community buy-in? Is there a policy that needs to change or get supported in order to see this plan through? This is, oh, don't worry, I'm not going to read all these words. But this is sort of like some snapshot data that comes mostly from the Lisa Horn report, but some of it has been updated since then. This just is a really good way to take a look at the conditions of our system as is, right? This is where we are now. And that's the one that has the graphs on it. And then the other page there is the metrics and the outcomes that we are aiming for if with full adoption of the plan. Thank you. That is my long presentation. I would be happy to answer any questions. I know I just said a lot of words. Or not.
What do you think it takes to get started? I mean,
Well, so
when you visualize it.
yeah, I mean, we're started is what I'll say. We're started. What it takes to get finished is I think really truly that community-wide buy-in. I think and I don't think everybody has to agree about all the things or even all of the interventions, but even just sort of saying like, we're in, how can we plug into this plan? Or how can the way we're doing services, how can we take a look at how we're administering services now and see if there's some opportunities in this plan to enhance our service delivery to those severe service needs? I think until the issue of homelessness isn't viewed as like a single system issue, that we won't see the change that we would like to see in our community, that we would all like to see in our community. That's my best answer. The system is under resourced. There are certainly like financial investments that are at some point going to need to be made in our system. We have some gains, we're getting, some housing has been built, more affordable housing has come online. There are some supportive housing units coming. We're not at a total standstill, but we are below where we need to be as far as stock, like straight up bedrooms in which people can sleep is where we have the greatest need right now. Homelessness is many things, but at its core, it is still a housing issue, right? So until we have housing adequate enough to house people that are able and willing to live in housing, we won't have solved the problem.
Libby, could you speak more about the funding streams, the, federal, state, county, city?
Yeah, sure. So I'll make sure to provide a link to the full document where there's a whole like funding appendix. But what comes into our community most right now are, we get HUD dollars through Continuum of Care. We actually have a very small amount of funding that comes in through the Continuum of Care. We also get HUD dollars that goes into the homeless response system through the Community Development Block Grant funding, CDBG, which comes into the city of Ithaca is an entitlement for, so they get a certain amount every year that they fund, that they grant out for certain projects. And then the county also has a mechanism to access that CDBG funding. The state dollars come primarily through the Office of Temporary and Disability Assistance, and those are those local DSS dollars that are running programs like the rental supplement program, or and also, paying for the cost of shelter, emergency shelter all runs through the Office of Temporary Disability Assistance locally. The sort of newest or most innovative money that's coming into the community right now is from Empire State Supportive Housing Initiatives, ESHI, and the governor has this goal of, I forget what it is, many thousands of supportive housing units being added in New York State by 2025. And they're doing it through this eShy funding. And eShy funding is a partnership between a nonprofit provider, a developer, a property developer, and the state, right? So some examples of eShy that are in our community now are the 40 units in Art House that are set aside for youth who are experiencing homelessness. There's some units in Founders Way that has that funding tied to it. But that's kind of it for straight up homeless response system money. So what our community does is be nimble and try to tap into other kinds of funding, or try to braid funding together and be creative with funding. And Section 8 vouchers is a tool that we use a little more in our community in the homeless response system than you would really actually want to see a homeless response system using Section 8 vouchers, because they don't come with those support services.
Well, had on your chart that you needed 100 studio 1 bedrooms. So
Yeah.
that's a plan. That's a need. What do we have numbers as to what's out there now?
Yeah.
What's
What exists?
yes.
Yeah,
Yes, and then how many people are homeless?
sure.
How many people?
Yeah. Yeah. What's the scope?
Yep.
Yep. So there's a lot of ways to measure that information. What I can say is, well, I can tell you exactly how many units there are of supportive housing. That's homeless response system set aside supportive housing. So I'm not counting any of the, like anything Unity House for people with developmental disabilities, or any of the Lakeview housing isn't in this calculation either. So this is set aside, has a requirement for homelessness at entry. There are 141 units of permanent supportive housing in all of Tompkins County. That is a permanent supportive housing project. So they're primarily Tompkins Community Action. So it's Magnolia House, Chartwell, Amici, Corn, and then those eShy units in Founders Way. And then there's probably another 40 or so. Well, there's 40 in the pipeline in the Sterry, which is the Green Street project. And there's another 20 or so more in the pipeline from eShy, but less than 300 units of permanent supportive housing for our population. Permanent supportive housing is the highest level of care, essentially, in the homeless response system. So we use coordinated entry to screen people for what we call their vulnerability, and people who have the highest scores would be recommended to be in a permanent supportive housing unit. We have every year about 600 people, unique individuals experience homelessness for at least one night in Tompkins County. Many of them sort of come, go, stabilize, we never see them again, or whatever, it all works out. And then this population that we're talking about now, this population of people experiencing chronic homelessness and the severe service needs, we have a pretty stubborn population of about 120 unique individuals who fit that criteria. And they're mostly right now outside or in the emergency shelter. Yes, but there's a lot of ways to look at the data, or there's a lot of data. And if people are interested in data, I'll send the link to our website. We're trying to get even better about sharing out data. We just did a really interesting look at our point in time count population. So HUD every year requires that continuums of care do what's called a point in time count. So they, in the last 10 days of January, you're required to go out and count every person experiencing homelessness in your system. People who meet that definition of literal homelessness. So sleeping outdoors or in a place not meant for human habitation or in the emergency shelter system. So not couch surfers. So we did the point in time count. There's about 200 people in our point in time count this year. It was on January 23rd of this year. And we decided to use that pool of people to do a really deep dive at who are these people? What's their deal, right? Where are they from? Can we tell are they local? Because this is a question we get asked a lot in public. Are they from Tompkins County? So we set about trying to answer that question. Are they local? Do they have disabilities? What are their disabilities? And it was very interesting to really just dive into that population of 200 people and take a look at what it looks like. And what we found is like the median person experiencing homelessness in Tompkins County is a single individual. He's white, he's male, he's between 35 and 42. He has dual diagnosis, mental health and substance use disorder, and he has more than 3 episodes of homelessness in his homeless history in our county. We know that, we all know that guy, right? Everybody is seeing that guy probably in their head. And so that is the other reason for that recommendation. I might be jumping back a little bit about the size of the units, because we have a dearth of those of single individuals, and they have the longest stays. They are the least served in the systems. And so that's why, but I can share that data. We presented it in the continuum of care meeting last month, and it was very interesting for people to just justify the numbers. What does it look like? What's the deal? Who is our population?
And Lydia, did the data also show that they were from the area?
Oh, yeah. Overwhelmingly they're from here. I think we had maybe less than 3%. I can look at the actual number of people that we either could not determine if they were a Tompkins County resident or verifiably were not. So because HMIS, which is our database that we monitor, is designed around national things, it's less fussy about county of origin than like a state database might be. It doesn't actually screen for it. So we added screening questions to be able to find out where people were from before they were in Tompkins County. But we also went back and looked to see how many episodes, if any, of homelessness they'd had in prior years as a measure of being like, well, this is a person who's been in our system for at least X number of years. We also took a look to see if they're, because there's this narrative, and it's sort of accurate, that during the winter months, because of Code Blue policy, the homeless population surges, right? It grows in the winter, which makes sense. And so people were saying, because the point in time count is in the winter, is this just all cold weather people? But what we saw is that people have enrollments year round. The same people are coming into shelter in warm weather or cold weather, and it has less to do with the cold weather policy, at least in that data pool, and more to do with their access to the shelter system.
I have a question. Thank
Sure.
you for the, this is Randy Brown.
Hi.
Well, the county just hired a homelessness coordinator. I think
Yeah.
it just started. So I don't know if you've interacted with that person yet.
Oh, yeah.
You probably know her well. But I have a question on the low barrier plan. Do you have funding for that?
No.
Okay, so
Nope.
you'd have to find funding for that. Okay.
Well, I wouldn't recommend, so my first recommendation would never be to supplant a system that already exists. I think that supplanting a system is not the best use of our dollars. The first thing I would do before I tried to fund and stand up an entirely new system is take a look at the existing system and find out if there are ways that some of those philosophies or ideals could be applied without having to fund a whole new system, right? So I know that regulations are super important and that people do really need to be in alignment with those regulations, but that doesn't mean that we can't take a look and see if there's ways that we can make the existing shelter lower barrier before we try to stand up something new. Does that make sense? Like,
Yeah.
Why have two if we can just take a look at the one we have and see if we can improve it?
I know that St. John's got rescue plan money from the county as well. I think they're adding a dozen rooms, maybe. They bought a house.
They're doing sorry, my daughter just got home. They're doing a sober living project with Oasis. And I think, yeah, which is great. Hooray.
Right.
Yeah.
So, because it's you can't
88
fill
more
all
to
the
go.
gaps at once, right? You've got to figure out how you're going to solve each individual population, right? So,
And there's room within, like in an ideal system, right? If we had everything we needed. So something I talk about, I like live, breathe, this stuff. So I'm in these conversations a lot. What I end up finding myself saying is, we have little parts of everything you would want to find in an ideal system, but our scaling isn't quite right. So I think that there's this idea when people first hear this plan that it's like this or that, right? Like I'm saying, everything needs to be low barrier, but in an ideal system that's functioning at capacity, there's room for sober living, heavy structure, lots of rules projects, along with as well as those more relaxed, lower barrier ones. Like there's room for everything in the system that works, and it doesn't have to. We all have to align around the idea that people can and should be able to access permanent housing, but we don't all have to do it the same way, I guess is what I'll say. In an ideal system. Right now, because there's a scarcity model and the resources are such, it does get to feeling like everybody needs to agree, or otherwise we're sort of like fighting our friends for the same dollars. Or we're not friends anymore because we're fighting, we don't align anymore because we're trying to get the same funding. A well-resourced system removes some of that scarcity model and makes room for, there's room for everything. There's room for faith-based projects all the way to like the wildest, most out there project that you can think of in a well-functioning system.
Lydia, can you speak more about the developers and why some developers have, provided supportive housing units in their projects, whereas others perhaps are hesitant to do so?
I mean, I think it comes down to money. It's not, this is like, obviously it's something that I have some knowledge about, but isn't really my area of expertise. But really what I've heard developers say time and time again is that it's about the calculation of profit to loss, and like, can they build a new building of the quality that they want to be able to build and keep rent at a certain level, right? Or whatever. It comes down to dollars is what I hear the most. The places that have invested in the developers most recently that have invested in affordable housing that also has these supportive units in it do tend to have some mission-based component to their work. So I can't think of just a straight developer that has done a project yet that doesn't have some mission or not-for-profit attached to their work as developers. So you have to care. They have to care enough to be willing to maybe get a little bit less return on their investment.
That's changed a little bit in the city. The city, when they were approving projects, they said you had to put so much lower moderate income housing in there and to get their approvals. But they changed that policy a little bit so the developer actually can put money into a trust, a housing trust, and pay that money per unit as opposed to actually building them and housing people. And that fund is growing. And I don't know what it is now, but it is anticipated will be in the millions within a couple of years.
So help me understand. So this money is in trust and with the idea that it will eventually be used to build units or to support services?
I think it's for more housing.
It's for units. Yeah, it's a development fund.
Yeah, and it's maybe $500,000 in that account now. I've forgotten now, but it's under another committee. Greg Mezzi, I think, is leading that committee and watching that money. Is it
city or county or
it has to do with the IDA and the Ithaca area economic
Called the Community Housing Development Fund.
Yeah.
Okay.
Yeah, whenever they get tax incentives for doing these things, that's how they incentivize them to do something. So they have a choice. They can do one of the other.
Yeah.
So at some point in time, those millions of dollars will be used to build what?
To address the housing shortage for, I don't know if it's no income to moderate income. So I don't know all the details on it because the money's just starting to come in.
Okay.
Because we're doing it.
Yeah.
But it's my understanding by 2025, there'll be close to $2 million based on current projects that, because people are paying significant dollars per unit.
Yeah.
You know, because they're supposed to they're building 200 units, they're supposed to put 30 units in this low to moderate, and they don't. They're paying significant dollars per unit to not have to do that.
Oh,
That's kind of,
Yeah.
they have a choice, so to speak.
yeah.
They're paying a lot.
And that brings up.
I'll get
another-
more information next meeting. I'll bring
Yeah,
it.
that would be very helpful to know. It brings up another issue of, providing home shelter for the homeless, supported housing units. And then you have people who, are working, who are low income, and they're also struggling for housing. So I imagine there's this tension there. Why are we providing housing for people who are homeless when we have people who are employed, working, but still can't manage to find, to find an apartment that's affordable and, they're in this community.
Yeah, that's a sort of another example of that scarcity model though, right?
Yeah.
And
Yeah.
it's just at the next level, right? And so when you're thinking about distributing money in an equitable way, you do want to serve the people who are bleeding, if we're thinking about like triage. And it is true that the pressure is so intense on people in every economic stratus in our community right now for housing. I will say, because I kind of straddle both worlds. Some of my work is more in that prevention and displacement and other low income housing stuff. And I do try to counter, that's sort of a false narrative in a way that is one or the other. It really can be both, and they're related, right? So if we invest in low income and affordable housing, it is an investment in the homeless response system, right? Because homelessness is a housing issue. So what I always end up saying is, yes, let's build lots more of affordable housing. There's one caveat to affordable housing when we're talking about it when we're talking about affordable housing and homeless response system stuff, that I always just feel like I have to say, which is the way that affordable housing is defined has a very specific definition that has to do with it's affordable, meaning it costs 30% of the gross income of people who are making up to 80% area median income in a community. And that's a boring set of words that I just said. But what it means is that the rent rates in affordable housing units are still out of reach for the lowest income people. So, and it's a little bit damaging to folks when they're hearing that all of this whole affordable housing project just got built, and then they go like, great, and to go look at the rent, and it's like $1,400 for a studio apartment, right? So when we're saying affordable housing, that's what we mean. That's what the word affordable housing means. So when I'm talking about developing housing, I like to use the phrase like low or no cost housing, just to differentiate that slice of people who are in the 0 to 30% area median income are still shut out of most affordable housing projects because they don't have enough money for the rent. Because you're only required, so you can be an affordable housing project if your units are affordable to people at that 80% AMI, which is like in the $80,000 range a year. So, and you only would have to have maybe 1 or 2 units at the 30% AMI, which is that more like 32, depending on your household size, $32,000 a year. Affordable housing units, it doesn't say they have to be affordable to the lowest income people. They have to be affordable to the highest low income people. Does that make sense? That's
That's really important. Yeah.
It's just important for the narrative, because I think a lot of times people are like, well, we're building and building and building, and what's going on? Why aren't people getting into these affordable housing units? All I see is construction all day long, and it's like, we are, and that's good. And people are in those units, but when we're talking about the homeless response system, it's still not affordable enough.
Yeah.
Sorry. After dinner, I apparently have many words to say about.
No, this is really great, Liddy. This is very informative.
Yes, very helpful.
Any other questions for Libby?
Liddy, I have a couple of questions for you. First, I just wanted to thank you for coming and speaking with us about this. And it's a great document, and the previous work that was done is really informative. There are a lot of really good ideas packed into a pretty short document. You know, it's not a hard read, but it's a slow read because there's so much information in there. And so I look at this plan and I think, okay, you're sort of making a lot of recommendations of what you think our community needs. And at the same time, you don't hold the dollars that are necessary to actually implement this plan. So what is your hope from this plan? Like, who needs to really, you said the community, but like in more specific terms, who needs to buy into this plan? And so that, like, it seems to me like what you're trying to create is like a county-wide Ithaca City model. Like if everybody adopted this plan, then we would create these things collectively, but you're not the funder.
That's right.
You don't have the power to get people to say,
Yeah.
hey, I want to do these outcome measures on equity. You know, I want to design a program that meets this particular need. So what do you need to actually get this plan done? And also, how does it align maybe like with other ideas that people have, like the city has a plan, there's the Tides proposal, like how does it, and I hear you when you say like, there are many paths, right? To finding, to addressing this need. And I like when you talk about scarcity, that's when people start to fight with each other instead of like being more open, like let's be creative and think of multiple ways. But at the end of the day, like a collective plan sounds like a really good idea.
Yeah. So as far as like, what do we want? What do I want? You know, as I was doing this work, and you know, I've been kicking around a while trying to think about how to. None of these ideas are particularly new. That's the thing I'll say. It's like these are so pretty standard set of interventions and ideas that are being implemented all over the country. But it never felt like quite the right time for people to get invested in it. And then COVID happened, and then we suddenly could see the effects of homelessness more. And it felt like the right time to sort of be like, here are some leading practices, and here are some reasons we think that they will work. I think as far as the money issue, the sort of what we have already seen is when what we envision and what I envision is that basically people are signing on to the plan, and then we're bringing in new dollars to our community, saying that we are, you know, I am Human Services Coalition and I'm applying to do my project. This is my project. I am whatever, but it is aligned with this community-wide plan, and here is why. And here is how that is connected to this community-wide plan, so that it's sort of like bolsters all of those creative ideas that everyone's having about this system, right? So it's like, it certainly enhances federal and state applications to see that cross-sector or cross-community endorsement and that sort of alignment in funding. In my time at Human Services Coalition, I've been able to bring in, you know, about $6.5 million of new money that wasn't in Tompkins County before. And the money that I was able to bring into Tompkins County had to do with our ability to work as a community, right? So one of those is this youth homelessness demonstration program funding that we have. That whole application, it didn't even ask us what we were going to do. It just said, how are you going to do it together? And so I know that that's across the sector. I know that that's a model that's successful for bringing in funding, is saying we are going to do it together, and here's how, because somebody already put it all down on paper, and we're just saying, yeah, we want to do this thing. We don't really want to fight over the money that's already out in the system. The hope is to bring in new dollars, new federal dollars, new state dollars, new philanthropy dollars into our community. I don't know, that's the money. We want people to be inspired by the plan, to create projects that align with it and bring in money to fund those projects. And we want to support those projects as the COC as well. So one of the things about our continuum of care is we don't have a lot of money, but more and more state and federal applications require continuum of care approval to apply. So that's sort of another place that's like the continuums of care are recognized as the local experts on data and evidence and homeless response system work, to the level that federal and state funders are requiring COC approval on those things. And so this is sort of another way to say, like, it's not just COC approved, it aligns with our community plan. I'll take any other advice for money though. There's no big sales involved or anything. Somebody else was like, so are you going to be raising all of this money? And I was like, that's not really how it works, but sure.
It seems that there's money out there at the state.
There is
and federal
money.
level. Yeah, it's just, and you've done a tremendous job in getting a lot of those dollars, but that's kind of heartening in a way that the money is there. It's just now you have to kind of find a way to,
There's money.
yeah.
And
Yeah.
Home ARP is a good example. So right now the city has an allocation of this funding called Home ARP. It's homeless response system money. It's got all these weird things about it because it's HUD dollars. But they are ready, because they are part of the continuum of care and are aware of the plan, have already sort of created a mechanism that the applications for those Home ARP projects are sort of automatically already going to be lined up with with this plan, because they had approved the plan. So they named, their funding categories as support services to support a housing surge, and prevention services to, as aligns with Home Together. So that's already creating. Those are the ways that you sort of get people funneled in together to at least like sort of working in a forward direction. The plan does not expect everybody to implement every program exactly how like the COC or somebody else says, but just to be meeting those goals of dignity and trauma-informed care and permanent supportive housing and stuff like that.
We're starting to run out of time, and I know we could probably talk about this for another hour, but does anyone else have any questions that they'd like to have answered before we close up?
Just a quick definition, you said 120, and you used the term stubborn. I used to know what that meant when I used to do
consistently the same number in the data set, whether it's different people or not, is what I mean by that. So the number hovers around that number, even if some of the people change, the number stays stubbornly at around 120.
Okay, they're not individuals that don't want
stubborn.
to go, or don't want
No,
to go to
I-
homeless shelter.
I don't speak to the personalities of people experiencing homelessness on an individual level,
Right.
at least if I don't have to.
I'd like to add that last year, Code Blue, there was about 120 people in Code Blue program staying in hotels or motels through state funding. This year it was 240.
Wow.
Wow.
So it doubled. It's the most it's increased in anybody's memory. Don't know why that. Maybe Lydia, you mentioned you have data. I don't know if you have that kind of data, but I thought it was interesting. I think there's a role for the county to play in this, not necessarily for building the housing, but obviously mental health support, those kind of things. And I think that you should be going to the table and asking them for support when you have your plan together. So.
Yeah. Well, I'll be at HED on Wednesday. If anybody wants to see the Liddy Barger song and dance again, I will be there.
I'll be there too. Yep.
Where?
All right.
Other Human Services Committee meeting.
Housing and Economic Development.
Yeah. Oh, that one. Okay, different one.
Well, this has been great, Liddy, and obviously
Thank you.
a great interest and a big help in us becoming more informed. So we appreciate your time and your expertise in this area.
Thanks. Enjoy the rest of your meeting. I'm going to go kick a soccer ball with my kid.
Thank
Hi, Liddy. Thank
you.
Bye.
Bye.
Thank you.
Randy, I'm just curious, like as a representative of the legislature here, will you bring this information back to the big legislature, especially when you, at the beginning of meetings, when people kind of share out?
Yeah, I'd love to get the data that she
Yeah.
presented. The Health and Human Service Committee, actually, the Human Service Coalition is presenting, I think, at the next meeting.
Oh, okay.
I'm not sure all of this data, but I'll make sure it gets discussed.
Frank, were you expecting we'd go ahead with the executive
It's
session?
probably a good idea,
Okay,
I would suggest. If,
We have enough.
yeah, okay.
right, so are we ready to do that?
We need a motion to go into executive session, right?
I'll second.
Okay, so one of the
Give me
things,
1 second to stop
sorry.
us from being.
that's right, I forgot about that.